Thank you. And thank you so much for inviting me. Yes, as some of you know, I've been working at Children's Hospital at Westmead with children with connective tissue dysplasia, including OI for... Oh, is that better? Okay, I've been working with the CTD team, connective tissue dysplasia team at Westmead Children's Hospital for about 12 years now, and it's a particular delight to me, and so much so that I've actually started doing a PhD looking at problems with hand function for children with CTD, including osteogenesis imperfecta. So that's sort of part of my work, as well as the sort of the day-to-day sort of seeing the variety of children from birth to 18. So today I'm going to predominantly talk about transition, and so transition from kindergarten up to 18. And so just so the key focus points, and this will, you know, some of those points that are relevant to children starting school are also relevant along the way, changing schools, going into high school, and then what happens after high school. So before I do that, I would like to just share some of the results of the first part of my research, which looked at participation for children. I just think it might be interesting to have a look at the results, because this particular study looked at parent perceptions of the impact of a connective tissue disorder, including OI, on their children's participation in daily activities, and that included self-care, school and leisure activities. And so this is quite relevant to just talking about transition, and a lot of what Verity was talking about earlier. Just it's really helpful to get parent perceptions, what matters to parents and to students, and I think having that focus for therapists is really important. So the study, I'm just going to talk about the OA results, and it was a survey of parents, and out of the 100 surveys, 42 were collected from parents of children with OI, and you can see here this is the distribution of children, and I chose children from 8 to 18 years because this is the age at which children are expected to be completely independent in self-care. And we can see that for us, most of the children with OI have either type 1 or type 4. So we have, and as Verity alluded to, we don't have as many children coming with the moderate to severe OI. So we can see that, and that may reflect on some of the results, but it certainly has given some good idea about what's been going on in terms of participation. So what we found, so in terms of symptoms, interestingly, musculoskeletal symptoms that were reported by parents included fractures, joint instability, pain and fatigue, but pain and fatigue were the two highest symptoms that were reported. So again, this is something that is well known. We're getting to know much more about and the impact, and it was interesting that fractures, and because of the bisphosphonates, fractures are coming out as less of an impact on participation. So in terms of self-care, about a third of parents reported difficulties with specific self-care tasks, and so we asked them questions about those self-care activities that we found as problems for children coming into clinic. So things like using a knife and fork, turning taps, washing themselves and dressing, and it's interesting that using a knife and fork came out to be a higher problem than things like washing and dressing. Now that could be that parents sometimes are not even aware of how much they help their children, or that they help them so much that children don't have that opportunity at times to do it themselves. So that was an interesting outcome that I found from this survey. In terms of school participation, 44% of parents reported school absences related to their child's diagnosis, and predominantly fatigue. 54% for fatigue and 50% for pain. Poor motivation was another factor of 32% of children that don't attend school because of poor motivation. But interestingly, attending hospital appointments were another factor, but it wasn't as large as the difficulties with pain, fatigue. So in terms of participation, again, parents reported difficulties with school activities within a typical week. And so those, you can see on the x-axis, mobility around school grounds, gross motor activities, including those within the school curriculum, such as PDHPE, which is what it's called in New South Wales, difficulty keeping up with handwriting, opening packets and containers at lunchtime, and then turning taps in the bathrooms and things like that. So for the children with OI, gross motor and handwriting difficulties were the two most predominant difficulties that came out in the survey. And so it's interesting, so as an OT, in terms of the main reason for referral for a lot of children with OI is difficulties with handwriting, pain and fatigue, keeping up within the curriculum. So that was certainly reflected in the survey. So what matters to parents? Interestingly, school-based activities are of more concern to parents than self-care. So 70% of parents reported concerns about their child's ability to keep up with school, and only 42% reported issues related to self-care. So again, that's something that we as therapists need to keep in mind when we are looking at priorities for therapy and then in relation to participation at school. Leisure participation was also a question that was asked, and 71% of parents indicated that children with OI have problems with leisure participation, and again, pain and fatigue were the most frequently reported symptoms. And interesting, again, that's something that Verity alluded to. 47% of parents reported their child's condition of OI was a barrier to them spending time with friends due to fear of injury or fracture. So that certainly is a big concern of parents and of children, just in terms of that whole ability to be included with friends after school. And again, it's something that we need to consider when we're looking at goals for therapy. So what can we learn from this study? That school and leisure participation are key areas of concern for parents and for children. And so therefore, therapists do need to prioritise therapy based on family and child concerns and needs, and also to make sure that we are liaising with families and teachers to improve student participation at school. And that we don't just leave it at school, that we make sure that we can help families to look at leisure options, what happens after school. And it might be that matter of balancing rest time after school with then making sure that there is opportunity for that interaction and inclusion with leisure activities outside of school. So moving on, therefore, to focus on looking at what we need to think about when we're looking at transition. So obviously choice of school is important, and with the aim of promoting inclusion and maximising participation. It's something that we've spent a lot of time talking about, and collaboration. And I think that really, if you've got good collaboration between the school, the family, the student and the therapy team, then I think the system can work really well. And I think that becomes a key issue in terms of choice of school. So when you're looking at whether it's a kindergarten student or a high school student, making sure that you've got that good collaboration with the school, whether it's the principal or the deputy principal, and I think that's the first issue that I would consider when choice of school, because you might have a school that has got 3 levels, lots of stairs, but if the school is willing to assist with modifications, then you might be much happier than a school that is on a level ground, but there isn't a good feeling of inclusion and participation. And certainly we've found that, I've found it over the years, that we've worked very well with some schools that have been in a situation where there are 3 flights of stairs and equally had difficulties. So I think that's a really important factor to consider to start with. It's also, it is useful and practical to have an OT come in, because we write letters of support to get funding from the Education Department if modifications are required. Equally, to make sure that we can put those safety education notes in play to make sure that we maximise participation and minimise fracture and injury. So all of those things are important to consider, such as making sure that there is a quiet place that students can play when they're recovering from injury, or if it's not safe in a large school environment. So all of those things need to be considered. So access to amenities and looking at all those practical things related to short stature, whether or not you're needing to use a wheelchair, the toilet block, canteen, bubblers, and then the need for additional assistance. And I'm sure that those of you who have got young students now and who need that teacher's aid assistance or support, it can be tricky. It can be tricky negotiating how much assistance that teacher's aid is going to provide to how much independence that student is able to have. It's very difficult, particularly because of public liability and all of those insurance issues. So schools can be very, very dogmatic about following rules in terms of assistance, and so that can be difficult, and I think it can be particularly difficult for high school students who want to have a bit of freedom but who still need that ability of assistance to get around safely. So it's a juggle. Mobility options, so making sure that there's the just right challenge of exercise, upright mobility versus using a walking frame versus using a wheelchair. So, and that will be determined by the age of the student, the fracture risk, fatigue levels. So because you want to maximise curriculum access, being able to focus and engage in the classroom, it might be pragmatic to make sure that there is a wheelchair and so that the student isn't going to be so exhausted by getting themselves around with a walking frame or walking that they're exhausted when they sit down in the classroom. So equally in terms of choice of wheelchair, nowadays there's some fantastic options with power assist so that you can have a combination of manual versus power, and that can be a really nice option. So looking at that, the other thing you do with all of these options is to consider what is the student prepared to do. And I've got a number of students who have been so determined not to use a wheelchair that they will put up with those fatigue levels and those pain levels. It means that by the end of the day they're absolutely exhausted, but they're not going to take that chair to school, even though they've got a nice new chair and we've got everything set out. They keep that in the cupboard, and you know that's their right, and it's something that we need to make sure that we can work with them about. And hopefully with age and maturity, then the benefits of not feeling fatigue can outweigh the issues with feeling different. But it's something that we need to respect as therapists and families as well. So in terms of participation within the curriculum, so again, we need to make sure I'm working with teachers, schools and families to maximise opportunities for inclusion and collaboration. And that, again, I've already sort of alluded to that ability to be included and interact versus overprotection. And that's a very tricky one, and that's going to be very individual for you as a family and for your for the students as well. I've recently heard that Sport and Rec within New South Wales are now working with families to help with better engagement and better choices of gross motor activities within schools, and I think that is going to make a big difference, because I think so often students are relegated to the library during gross motor activities, and I think that's completely unfair, and there are so many options now that can provide inclusiveness that I think that's it's really welcome that the Sport and Rec are now willing to look at those and to work with schools. So it's certainly something that does need cooperation. And again, as I mentioned before, the effective use of teacher's aid so that again they're providing the right amount of help without being invasive. And on top of all that, we need to consider just the effect of pain and fatigue on participation with gross motor activities and within the classroom itself, and look at the effect of activity on concentration. So those are just sort of key points to consider. So when we look at curriculum access, one of the issues is in relation to seating and supportive seating, because many children with OI, regardless of the type, can have vertebral crush fractures, which can cause pain and discomfort. And so therefore making sure that the classroom is set up so that they do have good back and foot support. Using a sloped writing surface can help with increasing posture. Also considering alternatives, because sometimes there might be a need for a soft chair in the corner, which is easier to set up in a primary school situation. Getting out of a wheelchair, being in a comfortable position, being in a more a prone or lying down for a moment, as well as being able to get up and stand and to change position, because that can be important and needs to be considered when looking at seating. So, and then obviously a key area that I spend a lot of time with is looking at fine motor activities. And we know that 60% of a school day is taken up with fine motor activities. Children with OI can have difficulties with hand function, hypermobility, joint deformities and reduced grip strength, and all of those things are going to have an effect. And for a kindergarten student spend a lot of time colouring in, doing cutting out and things like that. So if they're having difficulties and they're fatiguing at that point of their school career, then that can lead to avoidance. And so it's just important to make sure that those things are dealt with, and so that solutions can be provided to help with that. Equally, for high school and late primary school students, the biggest emphasis in terms of fine motor activities is handwriting. Note-taking, keeping up in the class, timed assessments, and all of those things become really important. And so I know from the studies that I've been doing that 55% of students with OI are reporting problems with hand function and handwriting because of pain and fatigue. And so that's going to have an effect on their ability to keep up and their academic performance. So we need to consider that. So therefore, and as I said before, and as a young student may start to avoid doing that, sort of Mondays, what do? We have to write what we did on the weekend, but my hand hurts because I was doing other things, and so therefore they start avoiding these activities. But that's not going to give a true reflection of their abilities, and so we need to look at what are the options. And so for note-taking, looking at whether or not older students can keep up with timed assessment tasks, whether there's a need for special considerations, and so for things like NAPLAN, for the story writing component of NAPLAN, and for here in New South Wales, that horrible HSC, the Year 12 exams, and I'm sure there are probably comparable exams in other states which require, and interestingly in this day and age, it still has to be done it's still handwritten. And so, we might be very good at recommending the use of a keyboard, and that often happens for students right from maybe Year 5, and then suddenly they get to Year 12 and they have to do a 3-hour handwritten exam. And so, that's not fair. And it's very difficult, unfortunately, here in New South Wales to provide arguments to use of a keyboard, extra time, or rest breaks. And so we need to keep that into consideration. And so we need to monitor how hand function is affecting performance, and look at what are the options to try and make sure that academic performance is being realised for these students. So solutions, energy conservation, pacing, rest breaks, extra time, looking at equipment to stabilise hands, wrists, splinting, looking at pen grips, different types of pens and pencils to make it easier, and then looking at those things, handwriting versus typing. But again, with all of these things, we need to look at student compliance, because I think that there's always students who don't want to be different, and again will put up with pain rather than use a splint or have a pencil grip. But if all their friends are doing the same thing, and a lot of the time that happens because we do have quite a hypermobile population, and so using a pencil grip is okay, but anything else might seem to be too different. So it's usually what I find is that there's an age at which students find that either their pain levels and their fatigue levels are so high that they really do benefit from the solutions such as splinting, or the other options that are available. So it really, and that's a very individual thing. But certainly there are things that, and strengthening. So we're looking quite more in more detail about strengthening, and that's something that I'm doing as part of my my studies. So. Transition from high school. So again, with all of this, it's really important to make sure that transition happens early. So you might be leaving. It might be important to consider looking at equipment and things like that in year 10 or 11 prior to leaving school, thinking about what's happening after school. How independent is your child? Have you been doing everything for them, and then suddenly they're in year 12 and they can't do those things? So making sure there's time to organise things. Learning to drive. Now, if you are a student with OI with short stature, you will need to get a medical clearance to get your driver's licence. You need to get vehicle modifications, and you need a special driver instructor, so you need to instructor. So all of those things take time, and it's important to consider that in time if that's something that your child or the student is wanting to be able to access. Home modifications, equipment upgrades. Certainly it's much easier to do it when you're in the children's services, certainly in New South Wales, because there isn't a dedicated therapy team for OI here yet in New South Wales. Looking at options for tertiary education and how much support there is to assist with access around university, TAFE, and again looking at all of those note taking, because even at university exams are done handwritten, and so you will need to get special considerations, use of keyboard and things like that once you move on. And then looking at NDIS support if you haven't already, and certainly that can assist with things like driving, driver, vehicle modifications and things like that. So these are things that you need to sort of keep in mind as your child is going through high school, and allowing time for those transitions to occur. So, in summary, I think the main thing is maximising participation and inclusion, and making sure that you choose a school where that is going to work well, that there's good communication between yourself, between the education department, and it has to be the people that are higher up, the people that have got the influence over the finances. They're the ones that you want to have that good relationship, because you will get individual teachers over the years, and some will be good and some won't. But you need to make sure that those people who are making decisions about funding are the ones that are going to support that inclusive environment. And each family and student responds differently to the challenges of having a diagnosis of OI, and that's in terms of risks that they're prepared to take and all of those things that we look at in terms of getting around the school and being included in the school curriculum. So thank you. Questions?